Hi Kimberly, my name's Nicole. I'm going to be your student physical therapist today, and we're going to be palpating some different structures on your shoulder, hips, back, and knees and ankles, and your hand. Is that all right with you?
Yes.
All right, so we're going to go ahead and get started with the knee joint line. So to find that, we're going to go in and we're going to find the edges of the patella, and we're going to go out laterally from there once we find the soft spot between the femur and the tibia, and we'll work our way laterally on both sides. From there, on the lateral side, when we get kicked out of the joint line, we'll have found the lateral collateral ligament, and when we get bumped out on the medial side, we'll have found the medial collateral ligament. From there, we're going to go out on the lateral side of the leg, and just below the lateral condyle to the fibular head right here. And the fibular head's important because it's the insertion site for the biceps femoris and the lateral collateral ligament. From there, we're going to work our way down the tibia until we fall just off the end of it. And the first structure we're going to run into at the bottom down here is the talus. The talus is important because the anterior talofibular ligament attaches there, and it's also a crucial bone for the ankle joint. Then we're going to go medially from there on the foot and just up to the navicular tuberosity. The navicular tuberosity is important because it's part of the navicular bone, which is the keystone of the medial longitudinal arch and is the attachment site for the spring ligament. Then we're going to go out laterally to the base of the fifth metatarsal. So it's just going to be this little bony protuberance that sticks out here on the lateral side. It's important because it can help locate the flexor digiti minimi muscle and the third plantar and interosseous muscle on the bottom of the foot. And then we'll go back up to the ankle region, and we're going to look at the anterior talofibular ligament, which is going to run up here. It's going to connect the talus and the fibula together, and it's important because it's one of the most commonly sprained ankle ligaments, and it can be used to find the sinus tarsi. From there, we're going to go ahead and work up. All right, so we're going to go ahead and start with the acromioclavicular joint. So to find that, we're going to run down to the end of the clavicle until you find the end, and then you run into the next bony structure, which is going to be the acromion. So that space between the two is the acromioclavicular joint, which is important because it's a common site of shoulder separation and is the main articulation holding the upper extremity to the trunk of the body. From there, we're going to walk down from the acromion down the spine of the scapula. Spine of the scapula is important because it serves as the division between supraspinatus and infraspinatus, and then more medially, the spine also serves as a good landmark for the division between rhomboids minor and rhomboids major. Then we're going to go back, work our way down the edge of the medial scapula until we hit the bottom, and that's going to be the inferior angle of the scapula. The inferior angle is important because it's the attachment site of teres major, and it's also approximately in line with the T7 vertebrae. From there, we're going to move anterolaterally to the front of the shoulder and find the greater tuberosity. So it's going to be a little bony protuberance sticking out the front. It serves as the insertion site for supraspinatus muscle in the lateral border of the bicipital groove. And then we're going to go back up, and just off the end of the acromion, you'll find a space of soft tissue. That's going to be the subacromial space. The subacromial space is important because it serves as the insertion site of rotator cuff muscles and can help locate the subacromial bursa. Then we're going to go back out to the front. The clavicle is going to have a concave portion as it kind of goes concave and out towards the lateral shoulder. In that dip there, if you push in deep, but not too hard because it's sensitive for patients, you find the coracoid process, which is an insertion site for the pectoralis minor and the coracobrachialis muscles. From there, we're going to work down the arm, and we're going to go down the humerus until you find the end, and that's going to be the lateral epicondyle. The lateral epicondyle is important because it's the origin of the wrist and finger extensors and also the site of attachment for the lateral collateral ligament. Just medially, same place, but on the medial side, you have the medial epicondyle, which serves as the origin of the wrist and finger flexors. And if you roll just medially, you find a groove that's the ulnar nerve sulcus. If you go back to the lateral side, just below the lateral epicondyle and give a little pinch, you can find the radial head. You can confirm by having the patient pronate and supinate, and you can feel the head move beneath your fingers. The radial head is an important site because it's where the biceps tendon inserts on the radial tuberosity, and is also a site for nursemaid's elbow or radial dislocation common in children. From there, we're going to go down to the end of the hand, have the patient put their hand in full extension. We're going to locate the base of the thumb here. You can see some of the ligaments coming in. That's a space known as the anatomical snuff box, which has the scaphoid bone as its base. So the scaphoid bone is important because it's commonly injured when you fall on an outstretched arm, and you can find the radial artery running through just over the top of it within the anatomical snuff box. From there, we'll go medially, and we'll run down the forearm until you fall off the end of the ulna, have the patient radially deviate. You'll have a gap, and then the next bony structure you run into is the triquetral bone, which is helpful to find because it allows you to find the pisiform, which is just on the palmar surface of the triquetral bone, and the hamate bone, which is just distal to it. Now we're going to find the C2 spinous process. So to do that, we're going to find the base of the occiput and move down until you feel the first bony protuberance sticking out at you. That's going to be your C2 spinous process, which is important because you've located the region of the atlantoaxial joint, which is the dens of the C2 vertebrae with the atlas, and that allows your head to pivot. It's also a good landmark because it allows you to count down to other vertebrae in the region. Then we're going to go find C6 and C7 spinous process. So we're going to locate the spinous process that appears to stick out at us the most, put our finger on that, passively move the patient into flexion and extension. And if your finger does not feel the bone beneath it disappear, then you know you are on C7. So then you can move up one vertebrae, go flexion and extension, and you can feel the vertebrae disappear with the extension, meaning you're on C6. The reason to locate both of those is C7 is the insertion site for the nuchal ligament, and if you C6 and C7 are also very prominent, and 7 serves as a very good landmark for finding other vertebrae. From there, we're going to find the articular pillars. So you find the spinous processes, and you're going to go just out laterally. You're going to feel a whole lot of muscle structures coming back at you. You have to push in pretty deep, and then you'll find the articular pillars and the facet joints. These are important landmarks. If you go just lateral from there, you can find the transverse processes, which carry the vertebral arteries, which are important in the region. And you can locate quite a few of the cervical spinal muscles. From there, we're going to find the first rib. So to do that, I'm going to palpate down the patient's neck. And once I hit the top of the shoulders, I'm going to palpate a little bit more firmly until I find the first bony structure pushing back that I can feel underneath my fingers beneath the trapezius muscle, and that's going to be the site of the first rib. You can tell because you can feel it running anteriorly and posteriorly. It's an important landmark because it serves as the attachment site for the scalenes and is also the opening of the thoracic inlet. All right, so we're going to go ahead and find the ASIS. So we're going to come in, locate the iliac crest, come just forward until you feel the two bony protuberants sticking out in the front. Those are going to be your ASIS, and they serve as the origin of the sartorius and the inguinal ligament. From there, we're going to find the medial femoral triangle. So we've already got one landmark here with the ASIS, which is going to be one of the insertion sites for the inguinal ligament, which runs across the body from the ASIS down to the pubic tubercle. Then we've got the sartorius serving as the lateral border, and it's going to run ASIS down to the pes anserine. Put the patient in a figure 4, have the patient adduct into my hand. That's going to make the adductor longus pop out, so that's going to give you all 3 of your borders. That's an important landmark, the medial femoral triangle is, because it serves as the site for the femoral nerve, artery, and vein running through there. From there, we're going to find the greater trochanters. So we're going to come out to the side of the patient's hip, squeeze in with the palms of your hand, and the big bony structure that sticks out into the palms are going to be the greater trochanters. Those are important because the glute med attaches there, and it's a place of referred pain from the pelvis, hip, and low back. From there, we're going to find the liver. So, Kimberly, are you okay if I roll up the edge of your shirt to find your liver?
Yep.
All right. So to find the liver, we're going to find the inferior edge of the rib cage, the costal cartilage, and kind of take your fingers and kind of scoop underneath and have the patient inhale and exhale, and you can feel the liver move with the movement of the diaphragm from inspiration and expiration. Liver is important to find because it can determine if the patient is appropriate to be seen by PT, and it can also be a site of pain, of referred pain from the T6 through T9 vertebral region. All right, so we're going to find the PSIS. So to do that, we're going to find the iliac crests and follow them around medially and posteriorly until the end. So then you have your PSIS. They're an important landmark because if you draw a line between them, it approximates the S2 vertebral line, and it also serves as an attachment site for the multifidus. Kimberly, are you all right if I roll your shorts and lift your shirt just a little bit to get to a couple structures?
Yes.
All right. So next thing we're going to find is the sacrum, the ILA. So if we find the PSIS, we're going to go just a little bit inferiorly and laterally. You find the edge of the sacrum and you work your way inferiorly until you feel it go medially. So the important thing about the ILA is it serves as an attachment site for the posterior sacroiliac ligament and the sacrotuberous ligament. From there, we're going to go ahead and go back to the PSIS, which we know is approximately a S2. And we're going to count up 2 vertebrae until we find L5. L5 is an important spinous process to know about because it's a common place of injury for patients, and you can approximate the iliac crest height as well. Then we're going to go superiorly, and we're going to find the 12th rib. So to do that, you're just going to push on the soft tissue and work your way superiorly until you run into a bony landmark there, and you can find the 12th rib. The 12th rib is important because it serves as the attachment site for quadratus lumborum and is one of the 2 floating ribs. From there, we're going to find the ischial tuberosity. So to do that, you're going to find the gluteal fold and then work superiorly with your thumb to find what's commonly known as the sit bone. May I roll your shorts just a little bit?
Yep.
All right, so I found the gluteal fold just here. So I'm going to take my hand, push up with my thumb until I feel the bony protuberance up there. That's going to be the ischial tuberosity, which is an important site for hamstring insertion and sacrotuberous ligament attachment.